Hello, everyone, and welcome to the Quorum Podcast. This is where academic medicine meets remote, austere, and resource-limited areas. Welcome back to the program. This is Aebhric O'Kelly. This week, we are again joined by Dr. Csaba Dioszeghy, who is running our Masters of Austere Critical Care program. Csaba, welcome back to the podcast.
Thank you, Aebhric. Thank you. Good to be here.
I wanted to continue on from our conversation last week because the college has submitted our Masters of Austere Critical Care for a complete revamp. It's the 5-year update has come, and instead of just rubber stamping and keeping the same 10 modules, we've doubled it, and we have 20 modules now. We've created so many different pathways that students can choose to focus on as they go through the modules. And I wanted to have a podcast dedicated to your brainchild of this new Masters of Austere Critical Care.
Oh, thank you very much, Aebhric. I think this is not just a facelift. This is a complete rehaul of the Masters in Austere Critical Care. Basically, we listened for all the feedbacks. Although the feedbacks were predominantly absolutely positive, we identified that people sometimes want to use more flexibility, pick what they are most interested in. Our students are coming from all over the world. They're coming from all sorts of healthcare backgrounds. So not everybody needs the same amount of, basic or advanced topics. Some are interested in more in aeromedical. Some are interested in more in tropical. Some are interested in more in diving. All sorts of things. So essentially, in the new masters, we try to provide exactly double the amount of modules to what we have now. So you can choose from way more, and they can have much more potential exit doors as well. You can get, focused on ultrasound. You can focus on education if you want. You can focus on essentially basic practitioner level training or anything else, really. So research and academia, obviously. So I think it's going to be a really, really good program. It's really different than what we have now.
Yeah, so I looked around. I mean, we've been doing this for 5 years. So I looked around as we were getting ready to reaccredit this master's program, and I was looking for others. And of course, there's no other Masters of Austere Critical Care out there. We are the only ones. But I was looking at master's level of advanced practice and master's levels of advanced clinical practice from the UK. And we brought that in. We brought in what the UK master's programs are putting together for their advanced practice paramedics and advanced practice nurses. And although we can't get Health Education England to completely accept our program because we're not British, we have matched the learning outcomes. So we're seeing if this master's program would also give our nurses and paramedics advanced standing.
Yes, we actually had everything which is needed. So I think we have a chance that we're going to get through this Health Education England obstacle at one point, because we just provide everything which they need. So essentially, this new program has 4 major pillars, if you wish. One is the basic theory. The other one is clinical topics. The third one is practical clinical care. And the fourth one is the academic and research. So people can pick from basic theory, clinical, practical, or academic and research topics, and essentially just build up their postgraduate training as they wish. The basic theory will go through everything which is needed for those who are not actually already trained in critical care. It will teach people all the concepts of critical care and will go into the idea of how to use critical care principles even in resource-limited environments. Then the clinical bits, the clinical topics are specifically look into intensive care in resource-limited environments, which is essentially almost everything except the injury and trauma. There will be a specific topic about trauma, and there is a lot of prompt field care principles. There will be tropical and extreme environments, from the cold, the hot, from the very high or very deep, everything you can imagine. And we also introduced something, well, you actually suggested It's something which is called the medical support to resistance healthcare, which is an extremely new thing. I don't think it's very easy to find anywhere else where it's given any sort of academic teaching. Actually, you can talk about it, don't you? Want to tell
Yeah.
something about this
So
residence healthcare?
yeah, I put this in, and I wasn't. I'll be honest, Chubb. I wasn't sure that you were going to accept it because this focuses on creating and manning an ICU in the jungle or in semi-permissive environments that are only seen by resistance operations or military. And if we look at history, so the Forest brothers in the Baltics and even like Poland was practicing resistance healthcare for decades after World War II ended, and they're under the Soviet thumb. And these guys had a whole medical system that was under the radar. And we have to look at history, learn from it, and then extrapolate on what are the future problems going to be as we move forward. And no one is looking at an academic approach to MSIW or a medical support for irregular warfare or for resistance healthcare. And we need an academic backed look at this, because otherwise we're just going to be back to making things up. So we need to have evidence and we need to have academic rigor for these topics that are kind of on the fringe of what is currently being accepted.
Absolutely. And this is so. Yeah, I remember when you approached me with this topic, and immediately I thought that this is something no one else is offering at the moment, but this is something really, really needed because the world is just a mess. There's such a big need for this type of knowledge and practice, and if you can do it in an evidence-based or evidence-informed way, in an academic rigor, that is something we really stand out. And there are other things in the new curriculum which it's not really easy to find anywhere else in the world. And it's, for example, the improvised medicine. So we do have an improvised medicine, forum always offered improvised medicine workshops, but now we put this to another level. Again, evidence-informed, evidence-based, evidence-informed academic approach to improvised medicine, which is, I would say, bread and butter for resource-limited healthcare. Something which a lot of clinicians are doing all the time, but it's kind of time to put this into an academic and evidence-based background. And we have other practical care, practical modules. Of course, we have the new eye care. I think we discussed it last week. We have the ultrasound courses, different types of ultrasound courses, even tropical ultrasound and pre-hospital ultrasound. And then we have medical education in two topics, two modules. So we can actually have a postgraduate diploma in medical education at the same time. And of course, the academic part, the academic pillar of the master's is just still the very important one, obviously, with the research methodology and the degree projected thesis, where students can actually do a little research, with our help, with the faculty's help and mentoring.
At the moment, with the older master's degree, we have such a variance of thesis topics coming from our students. Like Zach Andrews had a microcirculation severity score for hemodynamic patients. Like, can you have on something that would be, well, very useful in an austere environment?
Absolutely amazing topics and projects come up, and it's a joy to help these people to conduct their little research. They need a lot of help at the beginning. Usually just to focus more because everybody wants to suddenly invent the wheel or do something very, very significant and large. And we need to help them to understand the scale where you can actually do a research, what's feasible, and also how to keep your focus on a topic. And there are all sorts of topics. We have topics about AI, we have topics about triage, we have topics about trauma care, we have topics about education, paramedic education. There's so many different things, so many very, very exciting little research that it really shows how big variety of our students really coming from all over the world and all sorts of different backgrounds.
It's interesting to see the variance of the students. Well, they bring their own passions in, don't they? They come in with their idea of what they want to learn, and we give them that option. And I think with this new, the double the size of a master's program, it gives them more options to find the one or two things that it's they're passionate about, because that passion, that push is what's going to keep them going through the program and letting them complete.
Definitely, definitely, and it's really great to see when they defend their thesis at the end, and quite often we just say that your thesis, your research, you think it's a small one, but it's such a good work. It's such an interesting topic that you should really publish it. And then our students actually go and publish these researches, and some actually continue their PhD work. So it was brilliant. So it's really not something which is a quite often people are going to master's degrees and do their thesis with a you know well, I have to do it, so I just need to pass this test. But for some reason, I think somebody who's coming, or anybody who's coming to this master's degree, it's such a special folks. They put their hearts and brains into these small research projects, and they really do something great. And it makes difference. It does.
Yeah, I agree, and I learn. So I get to observe these dissertation, and like the one yesterday. It was interesting to see the way that this student was approaching the topic, and yeah, more often than not, we're suggesting that they publish for research, and hopefully it'll ignite the fire so they can push the light of evidence just a little bit further into this this deep, dark place of austere medicine that we're trying to make a difference and shed some light on. So, Csaba, I know you got to go. You're busy. I appreciate you taking some time to talk about the Masters of Austere Critical Care. And our aim is to have it up and running by this autumn semester, and if not, very latest by the spring term. But it'll be interesting to see the students we have coming onto this program.
Yeah, absolutely. Thank you very much, Aebhric. I need to go because I have a meeting with one of the students, one to one in 5 minutes. So yeah, thank you for having me. Good luck.
Awesome. Thanks, Csaba.
Yes. Bye-bye.
Hello, folks. Aebhric is here. I am going to talk a bit more about the program. Dr. Csaba only had a few minutes to chat because he's busy. He's stepped into the Chief Operating Officer's role, which means he's doing the day-to-day of the college as well as running the master's program. But I wanted to go through the ideas and the new concepts that we have put together for this new Masters of Austere Critical Care. And we've submitted it for reaccreditation. We're waiting for it to go through the peer review process that all degree programs have to go through as they originally get their first accreditation. Then every 5 years, we have to resubmit to make sure that we're still on the cutting edge of research and information. But so we had the original 10 modules of the Masters of Austere Critical Care, and we have implemented those into some of the now 20 modules, but I wanted to go through them. So starting off, we've added ACC 701 is an anatomy, pathophysiology, and basic concepts in critical care. And the original ACC 701 was what's now 702, the core critical care skills, advanced assessments and managements of a critical casualty. We have 703, which was part of the original degree program as well, which is the advanced critical care skills for remote advanced practitioners. For 704, we have added principles of prescribing and applied pharmacology. And this is something that I think a master's level paramedic, master's level nurse needs to have if they're going to be working independently in austere environments. But this is also a requirement for the advanced clinical practice of the UK and the physician's associates, as well as the master's level nurse and paramedic, which are on the road of some of the junior doctor rotations in the UK. And I think in Australia, they have it as well. In the US, we unfortunately don't have a EMS PA, which I guess would would be similar to this, an EMS physician assistant or EMS nurse practitioner. But here in Europe, there is definitely push forward for that. So we had to add the principles of prescribing to meet that requirement. But I think it's important enough that I'm hoping other people will also take this. 705 is the eye care, the intensive care for resource-limited environments. Dr. Csaba and I had a chat about that last week, and this is the online portion of the course, which we've enhanced from the original concepts of the Masters of Austere Critical Care. And then we have the 5-day course in Malta as well, which we are doing at the moment. 706 is Advanced Trauma Care in Austere Environments. That module is run by Dr. Tom Stevenson, who's a Navy doc from the UK. He's an MD PhD, and he did his PhD thesis on wound ballistics. He is going to be taking that trauma module and developing that and pushing that forward. For module number 707 is a tropical medicine and austere critical care. I had originally wrote this as 706 in the original degree program, and we're building on that a bit. So I'm going to be adding more concepts of tropical medicine, specifically focusing on the critical care casualty, such as severe malaria. So somebody who can't swallow is malarious to the point where their brain is involved, and that is very much a critical casualty for tropical diseases. For module 708 is the critical and urgent care in austere environments. That talks a bit about primary care. Urgent care is also known as primary care for austere environments. So expeditionary primary care, or minor illnesses or emergencies that a medic, nurse, doc would be seeing in austere environments. Module 709 is the one that I slipped it in at the very last. I wanted to focus on this, and it's the medical support to resistance healthcare. And I feel that this is a topic that must be explored academically, and research and development must be pushed on this so we don't make the same mistakes that we did when we had resistance healthcare after World War II. And for decades here in Europe, there was resistance healthcare, and we need to learn this again and develop and make it better and bring in academia. So for 710, that's the module that's called Aeromedical and Critical Care Transport. That one focuses on HEMS, or any type of search and rescue, any type of aeromedical type concepts within critical care. That was originally 705 in the original Masters of Austere Critical Care. For module 711, 711, I have brought in austere and pre-hospital ultrasound. Now, yes, this is a 2-day course. This is a CPD course that we've been running all over the place. I ran it twice last month, once in Malta, once in Germany, and we're running this in all over the place. And it's important enough that I added it into the Masters of Austere Critical Care. And then to follow that on, module 712 is critical care and tropical ultrasound. So I did a postgraduate diploma from the University of Pavia in Italy on ultrasound and tropical diseases. And this is something that is fascinating for me, but this is getting more and more traction in science and evidence on using point of care ultrasound for diagnosing and assessing tropical diseases. So this is going to be a blended module. There must be hands-on to practice this. And we have clinical placements for anyone who's interested to take this module and tag on the clinical module as a follow-on to this, and then go to Malawi and go to Tanzania, go to West Africa to be able to see some of these tropical diseases. Last time I was in Tanzania at KCMC, we had a boda accident. So these motorcycles and the three-wheeled taxis, they get in accidents quite a bit. This casualty comes in, and he had fractured jaw. He had the fast EFAS was positive, so he had blood in the belly. But as I was looking at his liver for the EFAS, yes, it was positive. There was blood in the Morrison's pouch, but I just happened to see in his liver there was a cyst, and in that cyst was a wee beastie. There was, and I got a great video of it. that there was a tropical disease, a pathology in this guy's liver. No, we didn't get really focused on it because he was there for trauma, but it was only my experience with University of Pavia and this program in tropical ultrasound that I was able to see that. And I showed a video of this to my professor from Pavia, and we're thinking it might be kind of psychosis, but it could be a whole bunch of different things in the liver. And that just ignited within me this passion for ultrasound and tropical diseases in ultrasound. So that is why I've added 712 and critical care and tropical ultrasound. For 713, this is the clinical practicum in austere critical care practice. Do this hands-on clinical placement, and you can find your own place if you want, if we approve it, or you can go to some of our clinical placements, but you can package this with other modules such as the tropical ultrasound. So when you go and do module 713, which is the clinical practicum, you can use the skills that you've learned in this new Masters of Austere Critical Care as a hands-on to solidify that knowledge from head knowledge into your hands, the hand knowledge. For module 714, that's the improvised medicine for creating an austere ICU. Dr. Csaba and I had a wee bit of chat about that earlier in this podcast, but my premise is we are in the jungle in West Africa, and we have a person in a hammock who is extremely unwell, and we cannot get him out until the morning. So we need to treat this casualty. And what can we improvise? How can we create this ICU in a hammock? And this is the module that I'm putting together, and I'll be running this module to challenge the people, the students, the delegates, to think, how would they set up an ICU with only what they're carrying in their medic bag? And part of that is learning how to improvise. And this is a blended module. You can't do this online only. You've definitely got to come to Malta or wherever we happen to run it and just do some hands-on with the improvised medicine, ICU level scenarios at you to force you, to challenge you to create improvised techniques to deal with this. ACC 714 is all about improvised medicine for creating an austere ICU. For 715, the prolonged care of the critical casualty in austere environments is all about PFC. And how are you going to deal with this ICU level casualty for extended periods of time? That is also a blended learning module. So you can't do this as online only. You must come to Malta and get some hands-on experience. For module 716, Dr. Csaba talked about that. It's crew resource management and austere critical care. And this is the 5-day course in Malta. The current name for this is iCare, but we're splitting that out. So now iCare will be a master's module that is an online prep for this 5-day course, which is called Crew Resource Management and Austere Critical Care. It's the same challenges. The 16 scenarios that I've created for iCare and the hands-on clinical labs that we rotate people through as they go from scenario to scenario, they're all still there. It's the same program. So we're going to challenge you with 16 ICU level scenarios, but you're located in a remote middle of nowhere with limited or no resources, and you still need to treat this casualty. So that's 716. For ACC 717, module 717 is our generic instructor course. And we needed to do that because, well, for selfish reasons, the college needs to have our faculty with a academic backed instructor course. So we put this together as a blended course. And of course, we're going to allow anyone to come through. So it's primarily focused on our faculty, but we are going to let anyone come through who needs to get a generic instructor course, and we can focus this on austere critical care. And this will be online as well as hands-on. So for module 718, this is the clinical medical education, and that's the online prep for the GIC, the generic instructor course. For 719 and 720, that is the degree writing. 719 is research methods, critical appraisal, and peer review. And this is all online. It's 10 credits, 250 hours, and it prepares you for your degree project. Our faculty help you when you take this module, help you to choose a topic, help you to prepare the research methods for that topic. And we will be with you as you go through the last module, which is 720, the degree project for austere critical care practice. And we will help you learn how to do a research project or a degree project focusing on austere critical care. So folks, that's our new Masters of Austere Critical Care. I am so passionate about this and so excited that this is what we have. And when I originally brought the topic, the subject, the concept of the Masters of Austere Critical Care to Dr. Csaba, to John Clark, to other people within the College of Remote and Offshore Medicine, it was a new concept. And I had to convince them that this was something that is needed. And we see that now. It's one of the largest programs that we run. There's currently about 45 or 50 people going through our Masters of Austere Critical Care. And now that we're revamping this and reaccrediting this program, I have been able to expand this to levels that I couldn't even conceive 5 years ago when I originally put this together. And let's face it, in the 5 years, I have learned so much as a critical care provider, as an ultrasound practitioner, and what I've learned from teaching prolonged care and being part of Sean Keenan's SMS, the Specialized Medical Standards program that created the austere emergency care, and we're continuing to support the prolonged field care working group, which is part of SMS. So having that push for PFC, prolonged field care, at every SOMA, at every CMC conference, combat medical care conference here in Europe, at the tactical trauma conference in Sundsvall in Sweden, all these centers of excellence that are focusing on PFC, prolonged field care. This knowledge, this learning from the last 5 years is all going into this new Masters of Austere Critical Care. So if you're interested, I highly encourage you to keep a tab on our social media. We will let you know how this is going through the accreditation process and when we plan to launch this. But in the meantime, we are still running the Masters of Austere and Critical Care with the original 10 modules. People who are starting that now can have the choice to roll over and have their master's program adapted into the new one once we have it up and running. The cost of the master's program isn't going to change. It's still $9,500, I think it is. And 25 years ago when I did my master's of wilderness psychology, I paid $35,000 in US for my master's program. We are just not going to be doing the same thing of charging that much money because we're a nonprofit. Everyone at Quorum is clinical and has other jobs that keeps them busy. So we are doing this as a nonprofit. We are doing this as our passion to provide excellence in austere, resource limited environments. I encourage you to be better, to look at yourself and say, where am I now and where can I be in 5 years? And what can I do to incorporate my development, my learning? And I have created this master's program for people to challenge themselves and compete. So as a Green Beret, as a former SF guy, it's always about competition, but I have changed my outlook of competition. And the only person that I'm competing against is who I was yesterday. So I encourage you to compete against who you were yesterday. And as long as you continue to walk this path, you continue to better yourself, you continue to make the world a better place, to be better for your patients. Because this is what we're doing. This is why we're here, isn't it? This is why we're medics, to be better for our patients. So my challenge for you is do that. Embrace challenge, embrace things that's going to make you better. And if we see you on this program, it'd be brilliant. And I'd like to very much see how you get through and hear, like I've heard so many times before, the delegate as they sit and they defend their thesis, their degree project, and hear how they have made their little bit of the world a better place. I brought in evidence for such a small slice of the pie. And this is what keeps me up and keeps me going after almost 60 years of walking the planet. So I look forward to hearing from you on how you like the new Masters of Austere Critical Care. This has been a presentation from the College of Remote and Offshore Medicine. If you would like to earn CPD credits for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credit, free access to our virtual field guide, and discounts on our e-learning courses. You can join the team on our college website at quorum.edu.mt.